Hi, I'm Graham from Match Medics, and welcome to our podcast, Doctor Diaries, Adventures to Ireland, where each week we have a doctor come on to tell us their own personal story about relocating to Ireland. Thank you, Caitlin, for joining us this morning on our podcast, Doctor Diaries, Adventures to Ireland. Great to have you on.
Thanks for having me.
Yeah, and I guess probably best place for us to start your journey from South Africa to Ireland is when we first met, and I think perhaps the conversation started a little bit earlier than that, didn't it? So take us through that, and then how I first met your lovely family in Joburg.
So we were looking at moving. I saw one of your posts actually on Facebook, and so Brandon and I started talking about it then. And this was in 2019. So at the end of 2019, we were like, okay, we're doing it. June 2020, we'll move. So I told my employer that I would be leaving in June. And then suddenly in March, the world went to pieces. And suddenly we had to backtrack on that. So we decided to put it off. At the time, it was just Brandon and I. And then 2 years later, we ended up having our first child, Jack. And then when he was about a year old, we started rediscussing it, that maybe we should go now, because if we don't go now, we probably never will. We'll settle and Jack will go to school, and then we'll always wonder if, what if? So
Sure.
then I think you were doing your roadshow, so that was finally a chance to meet you. But I think we'd been chatting back and forth for now years.
Yeah.
And then after that roadshow, we found out so much more information, and that helped with deciding, like, okay, we were going to do it.
Awesome. And that's a big piece for us too, especially going out to South Africa, where a large proportion of our doctors come from. You know, meeting our team in person just makes that move a lot more real. What could you recall, taking from that session in Joburg that really sort of cemented the move for you both?
I found that some of the information that we found on Facebook on like moving to Ireland pages seemed to deter us a little bit, actually, where we kept getting told to do your research and it's not going to be like what you think. And I think that allowed us to, when we met you, we could ask some questions like the childcare situation. We were told that there's no ways you're going to get childcare until your child is 2. So one of you is going to have to stay at home, which Brandon wouldn't have wanted to do, and we were obviously coming over on my visa. So that was a bit of a deterrent. And then when we chatted to you to find out, like, what is the housing crisis like, actually, and what is the childcare like? And you were very reassuring on all of that. So I think that was one of the standout things, that it was going to be okay. No, everyone has a house. Every doctor you've moved managed to find a place. There are people who are parents already who have childcare. So it just helped to settle those concerns that we had heard.
Sure. And that's great to hear. And, that's everyone takes something different from those sessions. And as I say, it just makes that move a lot more credible and realistic, and our support also, being able to field as many questions as we can that are very personal, because everyone's move is very personal, as there might be some similarities with you and the doctor beside you in that room, but still your guys' journey is very unique to you. So we've been back since then, just back in March, and gosh, the country has changed quite a bit since then.
Oh yeah.
And I think you're right. I think you certainly did choose the right time to take that leap. So jumping into Ireland, then talk us through the start of your career here.
So like when we started work, or
yes,
okay,
yeah.
So I came over with a job offer for an urgent care clinic. Which was a bit different to what I had been used to. I used to work in the emergency departments, and now I was coming to an urgent care clinic.
Yeah.
So it took a little bit of adjusting on realizing that there's certain things I can do but cannot do in that setting, and trying to figure out the systems and how it worked. But with working with teams that have already been here for a while, it was quite easy to eventually understand all of that and realize how things work. And Yeah, so I've been working in an urgent care clinic for a year and a half now. I was just an urgent care physician and then recently promoted to their clinical lead.
Amazing. And
Cool.
we'll delve into that that sort of career climb in a little bit. But just going back to Laya Healthcare being one of the urgent care providers here in Ireland, and you jumping into what appears to be a bit of a South African bubble, a little mini community, and actually dotted across their network of clinics in Ireland. Did that help you settle into working here in Ireland?
Definitely, that was great. It really helps because the people that I was working with were coming from a setting that I worked in. So they were able to say, like, give me a lot of information on this is how this works there, this is like in South Africa, and this is how it differs here.
Okay.
And even medications, like the name of something is this in South Africa, it's this here. So it helped for me to settle and get back into my ability to treat as I usually would, just with subtle changes in medications and how things are done here.
Sure.
So it was nice to have someone to reference to that knew exactly what I was coming from.
Amazing. And how would you compare the work you did prior to moving to what you're doing now?
It was a lot more hectic, I think. So we used to do, obviously I was in a big emergency unit, so it was a lot of resuscitation and big traumas and gory things and people's lives on the line, whereas now the urgent care is more like walk-in minor things. So it is, I mean, we did have experience and exposure to those patients as well in our emergency units. But so I think the work is a bit easier from that point of view. We do occasionally get a resus. We actually had one, somebody had a cardiac arrest recently.
Okay.
And because we're all trained in emergency medicine, it was everyone just joined together and managed it well. But those are very few and far between.
Sure.
Also, the work hours I used to work in were very, very long. So I used to work 60-hour weeks.
Wow. Okay.
And I loved it. I really loved that job. But it was a lot of hard work and I was like not present a lot of the time. Whereas now I'm working 40-hour weeks. I have days off, which has given me a lot more time with my son when he's little. So I love that.
Yeah, and that is a big change especially when we talk to more junior South African doctors, preparing them for that difference in working time. They're getting so much time back.
Absolutely.
And even quoting 40 hours a week, some might say, well, that's like a part-time job by comparison to what I'm doing right now.
Absolutely.
How did you find that shift going from a very busy trauma environment to, for some perhaps a little bit more sedate and a little bit more controlled?
Yeah. At first, I felt like I was missing my old job and saving lives. But I think I also took a bit of time to adjust to having days off. Like I didn't have many days off, and then suddenly I didn't know what to do with my time.
To, yeah.
And also a very funny thing I noticed was in my previous job, I would never take a lunch break. I would eat as I go, like write notes, eat, and then carry on seeing patients. Whereas here you get 2 breaks, so an hour-long break and a 30-minute break, and you have to take them. And so this was also unusual, where you go and sit down and you're like, I don't know what to do for the next hour.
So having time back.
Yeah.
That's such a simple
feels
thing.
Unusual.
Yeah.
It was great. And I also eventually adjusted my mind that primary care is still helping people. I am still helping every single person that walks in that door that I see. It might not be that they're on death's door, but I'm still helping them and maybe preventing them from getting to that point.
Okay.
Which was a bit of a mind shift.
Sure. Quite a big one. So talk us through then, what does your day-to-day look like? So
we work from 10 a.m. to 10 p.m. So we'll do 12-hour shifts, either 3 or 4 shifts a week. So I suppose it's a walk-in clinic, so you'll see anyone who walks in the door with minor injuries, so anything from little cuts and scrapes to broken bones, some that are minor that we can manage and others that we might need to stabilize and send to the emergency department for surgery or whatever.
Okay.
And then also minor illnesses, so you'll say hi to the team, sit down, maybe have a coffee, and then as soon as the patients start arriving, you just take one as they come up on your list, and each doctor will take one. And then, you just consult, counsel people, write their prescriptions, might do suturing or send for x-rays, do ECGs, those sort of things.
Okay.
And then the breaks during the day. Yeah, I guess.
Rinse and repeat. Yeah. Okay. And then now, as you said, only recently jumped up to clinical lead. How did that come about? And what advice perhaps could you give to someone to prepare for that?
I suppose I have a really nice team. So they kind of suggested it when our clinical lead left. My team had suggested that maybe I should step up to that role, which I thought was a really nice thing.
Yeah. So it was your fellow peers that said, you're right for the job.
Yeah, which
That's
I thought
amazing.
was really nice.
Yeah, how flattering.
Yeah, exactly.
Yeah.
So I applied for it. They interview you, and then luckily I got it. So it's a little bit more responsibility. It's just a liaison between management and your team.
Okay. So how does that differ to the job you had previously then?
So I still have the job I have previously. I still treat patients as I did.
Okay.
I just also have a bit more responsibility where I would have to respond to patient queries or find out information to lead the team from management or things like that.
Okay. And do you enjoy it? Is that an extra element you like having as part of your job?
I'm still a bit new to it, so I'm still finding my feet on that, but I am enjoying it so far. I think it's nice.
Amazing.
Yeah.
And in terms of many people, have other subspecialist interest areas, is there opportunities within the minor injury space within Ireland to be able to explore that, or on your time off perhaps? Or
so the company that I work with, they encourage you to do extra training. So a lot of us have done like extra diplomas in various things. I'm currently doing a diploma in pediatrics, which they contribute towards, which is really nice.
Yeah.
You can't really specialize in urgent care so much, I don't think, but you are able to do these extra courses. You have more time, so you can do extra studies, diplomas, things like that, which could benefit you going forward.
Sure.
But as for like specializing, I think then you would need to go into a hospital or a GP setting.
In the public system.
Yeah.
Okay. And you mentioned pediatrics there. What's the sort of the ratio between pediatrics and adult patients that you'll see on a daily basis?
Probably about a third are pediatric patients.
Okay.
So we get quite a range from little injuries to minor head injuries that parents are obviously stressed and worried about.
Sure.
Lots of fevers, kids with runny noses and sore throats, and then sometimes really sick kids that we need to actually give nebs to or give medication and call ambulances for them to transfer to the hospital.
Okay. And how often would you have that emergency escalation required?
Maybe once a month or once every 2 weeks,
Okay.
I think. Most of them are things we can treat there.
Okay. And that is, I guess, the draw for a patient with an urgent care, isn't it? That they're treated there and then and sent on their way.
Absolutely. And it's really nice, I think, because if your child has a fever or they're vomiting, I found a lot of people struggle to get into their GPs, and they can only get into their GP in a week from now, which is too late if your child is vomiting or has fever today. So, and a lot of people don't want to go to the emergency department if it's something minor, but they do need medication.
Yeah.
So it's a nice in-between where parents can bring their kids in.
Absolutely.
Which I think is lovely.
And that is the section of the patient cohort that the minor injury service is providing, right?
Yeah.
As opposed to, we have to acknowledge there are challenges in terms of access to GP care in Ireland, and many emergency medicine doctors we might speak to talk about this specialty creep, where as a consequence of those challenges to access GP care, they find themselves in the emergency department, whereas
Exactly.
a decent portion of them could be treated in somewhere like Leah Healthcare.
Exactly.
Yeah.
And
amazing.
it takes a lot of the strain off of the EDs as well, because their waiting times are crazy because they have so many patients coming to them. So if we can take some of that, the minor things away, it will help them with their flow and their waiting times as well.
Sure.
So it's great.
The three elements within the primary care space, or the first entry point for any patient in the health system, work in tandem to support each other and relieve those pressures across the board.
Yeah.
Amazing. Anything else in terms of your career here so far that you want to add before we jump into life as a parent here in Ireland? Anything perhaps you might have wanted to have known before moving here medically?
I suppose just that the system is very different, but I mean, that would be anywhere. where any country you move to, the system is going to be different to where you come from. But it's easy to adjust. I mean, you figure it out as you go, and you have people who can help you.
Yeah, amazing. Great. Yeah. Well, let's dive into life then in Ireland. First day here with Brandon, your husband, and Jack, your little son. What was your first impression?
So we arrived very early, like 8 a.m. We did like a 24-hour flight. And with
the little one, I can only imagine.
He was surprisingly good. He was very busy on the first flight and then slept from the layover and then slept the whole way through the second flight. So that wasn't too bad.
Yeah.
But yeah, so we arrived. We'd come from South Africa where it was like 37 degrees. So it was really hot just before Christmas in Ireland. So we landed and it was cold. I think it was max 9 degrees that day.
Okay.
But everything was very Christmassy and there were all lights and people singing carols in the airport and it was very cute. So we were feeling quite festive. We actually got a really big tip in the airport, which I think was so helpful. We went to, there's like a little kiosk or a little shop there that sells chips and cool drinks and SIM cards.
Okay.
So we wanted to get a SIM card as soon as possible so that obviously we didn't have roaming on our current numbers. And so we went there and asked like which one should we buy, and the lady asked how long we were staying, and when we said indefinitely, then she actually suggested that we don't buy from there. We go to a Vodafone or an Air shop or one of those to get it from there because it would literally be half the price.
Okay.
So that was a really nice tip.
Yeah.
And then I have my best friend lives in Limerick actually, so she'd been here for a couple of years before us.
Okay.
So she drove all the way from Limerick, picked us up. We then went to just drop off our bags and pack smaller bags at our new apartment. So we saw our apartment.
Yeah.
And when we got there, we met a really friendly, nice Irishman who had come to view one of the apartments there.
Okay.
And he was so chatty. He was lovely. It was like a really nice welcome. That was the first like Irish person we had met.
Amazing.
And it turned out his son is the same age as my son.
Okay.
And then him and his partner ended up moving in there a couple months later, and they've become our really good friends. And at the time, he was like, "Come, let's go to the pub." And this was like 11 in the morning. We can't right now. But that was really cute and a nice welcoming. Yeah. And then we went over to Limerick for the first weekend that we arrived here, which was a really nice soft landing. So our friends welcomed us in, showed us around their town, and we really thought it was lovely and beautiful, and we were getting excited about exploring and life here.
Sure.
I remember also driving from the airport to our apartment, just seeing just such a silly thing, but all the chimneys, and we were like, look how cute that is. This is so like, we're in another place now, based on the chimneys of all
and is
things.
that just alien in South Africa to see as many chimneys?
But not the same, and not as many.
Right, okay. So
that was, a silly, cute thing.
Yeah. And as a parent, what goes through your mind when moving anywhere? What went through both yourself and Brandon's mind when you decided for your guys' future you need to do this?
So I suppose our big pulling factor, we didn't feel like we were necessarily running away from anything. We could have had a good life in South Africa as well. But the big pulling factor was like a new adventure and being able to travel and see a new place. And but I suppose concerns, we didn't know what it was like and how to figure out the schooling system. And like I mentioned, the worry about getting childcare, how was that going to work?
Sure.
And then when we arrived here, it is very difficult to get into creches. So you have to be on waiting lists for like 6 months.
Yeah.
But we managed to find the best childminder very quickly, who's just been a savior ever since then.
Yeah.
But then a big perk we found when we moved here is the amount of playgrounds. We were really excited about that because that's not really something that you get in South Africa. You could get some, not as nice as these ones, and probably ones we wouldn't go to, where we might have gone to a playground that's attached to a restaurant for Jack to play in.
Okay.
But here there was just so much access to these free playgrounds, which was just so lovely.
Yeah.
But I guess the things that you're concerned about would be, what is schooling going to be like? Is it good? Which I've heard it is great. Are you going to find someone to look after your child that loves them the way you do? All of those things, I think.
Yeah.
I don't know if I answered that question.
No, absolutely.
correctly.
Yeah. And has Jack brought you around the local playgrounds to tour the amusements?
Yes. Yeah, absolutely.
Yeah.
So we've even got like our favorite playgrounds already where we'll trick off to go to that particular one.
That's amazing.
To play. And you know that different ones have different things, and so as adults we end up having our favorite playgrounds as well.
That's amazing. And you briefly touched on community previously, and how the growing South African community here can be quite a help you with a softer landing. And I know our paths crossed again with another connection, just showing how small the South African community here in Ireland is, or how sort of close knit the South African community here is. We're talking about Lamont here.
Yes.
You share how that introduction came about?
Oh yeah, so Lamont lives at the same apartment block as us. So Brandon was playing with Jack in the playground near our house, and I was off on a run. And Lamont was walking with his dog. He's got a big
Bailey,
golden retriever. Yeah. It's beautiful. Yeah. And I think it probably started with Jack wanting to look at the dog, and then Brandon and Lamont chatted a bit. Found out that they were both South African, bonded over that. And then Lamont kept walking with his dog to where I was and said, "Oh, I just met your husband." And then we ended up chatting. He asked what I did, and I said I was a doctor. And he said, "Oh, he's working with recruiters that help bring over doctors." And he happened to mention Match Medics.
Yeah.
So I was like, "Oh yes, Match Medics brought me over." And then he said, "I'm actually meeting with Graham now. Someone named Graham Cosgrave." And I was like, "Yes, I know him well."
I think it was the following day I met Lamont and Bailey for the first time. Never have I had a meeting with the dog. And Lamont decided to bring along Bailey. They very much are. That's his co-pilot. But again, that just shows just how Ireland is so small, and that I think you're having to put yourself out there a little bit, and who knows what's going to come from any interaction like that. And like I mentioned, Lamont is a strong partner of ours, who's a sort of financial advisor for a lot of our doctors relocating here. So it's just so funny how that interaction came about, and just stereotypical that you're bound to come across someone perhaps once you move here to Ireland.
We actually, when we moved, we said we don't want to only go to South African things and only build a South African community, but somehow I think we just gravitate towards each other. It turned out our immediate neighbours in our passage, the guy went to the same school as me, and so they grew up in the same areas as us. And I think they had the same feeling, that they don't only want to be friends with South Africans, and then their first friends that they meet grew up in the same neighborhood and went to the same school. So it's funny. And then obviously almost every person I work with is South African as well. All the doctors anyway, not the nurses. And
you're right to identify that it's great having your own community here, but also to embed yourself with a wider local community is I think future-proofing your time here.
Exactly.
And to have, I guess, two streams, and who knows, those two sort of groups could intertwine at some point. And,
exactly.
Who cares where they come from?
Yeah. What has been nice, I guess, with having a lot of South Africans is that you all having a shared experience. So, and you know what you're coming from, the challenges or differences here. So it helped to have people to help you through those hard times because they know what you're going through. But then also it helped to, I suppose, build our confidence so that we do put ourselves out there. We'll chat to strangers on the beach who become friends, and then meet others. And I find you need to say yes to invitations. So that's the best way to meet people, build your community, across different cultures, is to, if someone suggests something, do it.
And that's definitely a really, really helpful piece of advice that I think everyone should take away from this. And delving into, obviously, correct me if I'm wrong here, Brandon is somewhat an extension working in the hospitality space with the caravan RV company that he's working in. So no doubt you guys have travelled a fair bit around Ireland so far. Would there be anywhere that you recommend for a long weekend away?
My favourite place that we've seen so far is the Dingle Peninsula in Kerry. So we spontaneously decided to go there for a weekend that we heard the weather was going to be really good. We were both off, so we were like, jump in the car, all jump in the camper van and let's go. So we last minute booked a campsite, which was right on the beach in Brandon Bay.
Yeah.
And the weather was amazing. The water was like turquoise. It felt like absolute paradise. It was just beautiful.
Yeah.
We loved every minute. We sat watching sunsets and swam in the sea. We drove on the Connors Pass in a camper van, which was terrifying.
But you survived it.
Yeah, barely. I couldn't watch. And we went to the Dunquin Pier as well. It's just the most magical, beautiful place. And it feels very Irish there. Like the shops and the pubs all have their Irish names. The people were so friendly.
Yeah.
It was just such a lovely experience. I'd really recommend going down to that part of Kerry.
Amazing. Thanks for sharing that. So now diving into our more interactive piece, I'd asked you ahead of time to have a think about a picture that sort of sums up your Irish adventure. Do you have one to share with us today?
So this is actually, funnily enough, the one that I went with.
Okay.
Which is Brandon, Jack, and I in the snow.
Is that your first experience of snow?
Yeah. So we had, when we were coming over, we were talking about having a winter's Christmas.
Okay.
So this was going to be very different. You know, we were used to sitting by the pool on Christmas Day or sitting on the beach. And now we were coming to a cold Christmas. And I remember Brandon saying repeatedly that he can't wait for a white Christmas. And I was like, I don't think that happens.
Not too common here, yeah.
I think you're thinking of the wrong place. So I think I let him down that we weren't going to have snow for Christmas.
Okay.
And then I think it was the end of November, we had quite a heavy snowfall.
Yeah.
And we always spoke, because it sometimes snows in the mountains in South Africa, probably about 6 hours away from where we were.
Okay.
So we always said, like, if there's ever snow, we must just jump in the car and go for it and try and see it, because we had never seen, I think we'd seen a sprinkling of snow, like sleet, really, before. So then when we had this big snowfall, we could see across the bay, because we're in Sutton, so we could see to the Wicklow Mountains across the bay, and you could see they were completely snow-capped. So we were like, let's just do it. We've been talking about chasing the snow for years.
Okay.
So we hopped in the car. All the notices on the radio were like, please don't drive up to the snow. Like, people are getting stuck and pulled out. And we ignored all that advice and just drove straight for it. Ended up just pulling off on the side of the road. I suppose the closer we got as well, they were, I don't know if they're pine trees or something, like those classic Christmassy tree-looking trees, which had the snow that had fallen on it, and it looked like a postcard. So we were driving through the roads in Wicklow with these like snow-capped trees, which was so cute. Yeah. And then when we finally got to, that was Sally's Gap, we just parked on the side of the road and hopped out, and we were having snowball fights with the snow, like on the road, basically. Yeah. And it was just like so magical, and we thought, we dreamed of this, and now it had come true.
Amazing.
So, yeah.
Thanks for sharing that.
Yeah.
Finish then for this next bit. Finish the sentence. So I knew I belonged in Ireland when.
You knew?
You knew you belonged in Ireland when.
Oh, there were two moments. Okay. The one was just recently. We live on the seafront, so I was going for a run by myself along the seafront one day, and the sea was so beautiful and the sky was blue, and it was just a real perfect moment. And I thought to myself that I would never have done this back home, because I wouldn't have like gone for a run by myself, for example. I might have run in our estate or like in our little complex, but I wouldn't have gone running on the road by myself and felt safe. And so I had this sudden realization that I felt safe and I was on my own and it was totally fine. And also I was running along like the beachfront promenade, which I always dreamed of. Yeah. So that was one moment. And the other was I watched Justin Timberlake live recently. Okay. Which was my teenage dream come true. Okay. And so I remember sitting there and I was like, this is why we moved to Ireland. This is brilliant. I would never have seen him in South Africa. So was it worth it? Was it worth the wait? Absolutely. Yeah. He lived up to expectations? Absolutely, yes. He was brilliant. Amazing. Two amazing moments to share. So thanks for doing that for us.
last piece for you on this section is many people will come across with the misconception that we all speak Irish. And you can confirm that is not the case, but there's plenty of Irish in our day-to-day lives. So we thought we'd try and test you a little bit. No doubt you've come across some of these, but whether it be place names, people's names, or Irish phrases, to see how you fare. So here's the first one of 3 for you.
I think Owen.
Very good. Yes. A man's name. This is a place name. Perhaps you've been there before.
Youghal? I don't know.
It's Youghal.
Okay.
We've again confusing. I appreciate there's plenty of consonants there that sometimes we just decide to, not say it all. And then last one here for you today.
It's crack.
Yeah.
Which is, what's the crack?
what does that? When you heard that first, what were you thinking?
I knew of it before we came over, but I didn't know how to use it in a sentence or how one would say it or refer to it. So, and one of my colleagues and friends would always walk in, that's South African, would always walk into the clinic and go, "What's the crack, guys?"
Okay.
So as I understand, it means like fun or like vibe, I suppose.
Yeah. And do you find yourself using it?
Occasionally, yeah. There's quite a few Irishisms that I'd learned from the same friend. Like she would explain things that...
Give us an example. If you can.
You know yourself.
Yeah.
What was the one I thought of last night? I can't remember. It's like the equivalent of us using... We say like, yeah, no... I can't remember it.
That's all right. That's okay. No,
but again, you've quite a few funny ones.
You've navigated crack anyway. Yeah.
What was a really funny saying though that we didn't understand at first was a lot of people say like "mind yourself," like "go well, bye," you know.
Yeah.
And in the beginning, Brandon thought it was like "watch yourself," so he thought it was like a threat. So
right.
He's like, "Well, you mind yourself." Which was a really funny adjustment where we're like, people are being nice to you, they're not threatening you.
Yeah. Did it take him a bit of time to adjust to that?
It was very funny.
Amazing. Thanks so much for sharing that. We'll finish on any bit of advice you might give to anyone who could be listening to this, who's contemplating the move, whether from South Africa or from any other part of the world, who are thinking about moving to Ireland. What would you say to them now?
I would say do it. I think the adventure of going to a new place and the experiences that you get are just so amazing. It puts you completely out of your comfort zone, which initially I was a bit afraid of. The first year is extremely hard, but it gets better. You start to settle, you start to feel more at home. So to also, I suppose, persevere even when it feels really bad and you want to go home in the beginning, it does get better.
Amazing. Thanks so much for sharing your story and thanks for coming on to the podcast today.
Cool. Thank you. Thanks for having me.
Thank you.